Hi, everybody, and welcome to our webinar today. I appreciate you guys being here. We are happy to bring you guys these on a monthly basis, and just want to say thanks for joining. I do want to say a couple notes before we start, is that today's session is pending approval from the CCB, and we have this submitted in. They have a 6-week timeline, so just want to be clear with you guys that this will be good for 0.6 CEUs, and you will receive that as soon as we get that. So I do apologize for the delay there, but you will also receive a copy of the presentation in slide format, as well as a recording this afternoon. So again, just want to say thanks for joining. And we hope you find today's session valuable. So just 1 second, let me get this up. So a little bit about us at Provider Trust. We are a software as a service company here in Nashville, Tennessee. And we believe that a smarter healthcare makes a safer healthcare. And we live this out by monitoring healthcare populations to identify compliance and credential issues before they impact patients. So if this is your first Provider Trust webinar, welcome. If this is your 4th or 5th or 15th or 20th, thanks again for being with us today. Our purpose is to create a safer healthcare for everyone. We believe this through and through. Please go through our resource library. It's very extensive on our website, and you'll be able to see some of the ways that we're pushing to make healthcare safer for everyone. A little bit about today's presenters. On the left, you'll see David Servadidio. He's our Director of Marketing. In a past life, Dave worked really closely with health systems and health plans to make sure their processes were more efficient and make sure that the folks that they needed to monitor were being monitored on an ongoing basis. On the right, you'll see Donna Thiel. She is our Chief Compliance Officer. Donna has 30 years experience in the compliance space. And before joining Provider Trust, she was the Chief Compliance Officer at one of the nation's largest health systems. So if you have a question about compliance or process, Donna is the person to ask for sure. Today's session, we're going to be covering the procedures supporting policies in your compliance program. And you have the right people on the call today to cover that topic. A little bit about today's agenda. We're going to start off with creating a strong internal policy structure. Then we're going to cover a quick case study on ongoing provider monitoring. And then we'll move into connecting process to the patient. And then finally, we'll wrap up with connecting HR and compliance in 2021. This is a subject that we're really passionate about. We see a lot of great work come from great relationship between HR and compliance. So that'll be a good section at the end there. We are going to start off with Donna covering the first section here, creating a strong internal policy structure. But I want to first start with a poll. So we're going to have 3 polls today. The first one being, who is responsible for creating your current internal policy structure? And we just like to do this so that you guys can get a feel for where your peers sit on the call today. And we just want to better understand your situation at your organization. So these are coming through. I like to wait till about 50% participation. So we'll leave that open for a few more seconds. And there we go. Do appreciate you guys joining in for the poll. Looks like the vast majority are responsible for creating the internal policy is compliance. So there's no surprise there, but it is nice to see that it can be peppered through the organization. So with that, after our first poll, I will pass it over to Donna.
Thanks, Matt, and welcome everybody. If you haven't noticed, the chat box is open. Dave has already started us off, seemingly implying that the Eagles are the most important football fan or football team. I, of course, live in Milwaukee, Wisconsin, and the Packers are just so much better than the Eagles. And I happen to have just quickly looked at the participant list, and I noticed that Donna quickly piped in from Pennsylvania on her allegiance to the Eagles. but I won't call anybody out, but I see a couple names on here that are really good Packer fans. So please help me out here in the chat box. Don't leave me hanging, Packer fans. So enough about sports. You all came here today to learn about or talk about policy management. So for those of us in the compliance space, we've all heard this many, many times, right? It's better to have no policy than to have a policy that you aren't following. So let's start and talk a little bit about the basics of policy management. At Provider Trust, in my role here as the Chief Compliance Officer, in the last probably 6 to 9 months, we've really started increasing the volume of processes and policies that we're writing. And as I sit back and I think about the challenges that we face when we're putting some of these together, sometimes we just lose track of the basics of kind of that 101 of where to start. So I thought that's where we would start today. So when we think about policy management and the basics, first and foremost, right, who owns it? We just saw in the polling question that 33 or 58% is compliance owns policy management. Then there's some other, we don't know what that 19% means. So really take some time and think about in your organization, where's this going to fit best? Is it compliance? Is it legal, HR, operations? You all know your organization's best, but take a minute and let's think about where it's going to be owned. The next one, what is the single source of truth? Do we need a policy on policies? We kind of get policy fatigue, but at the end of the day, if we don't have a process that's written and that we really understand of how we're going to manage these policies, it gets a little confusing. So think about how you're going to organize your thoughts around policy management. And then think about those as we start looking into the how-to. Figure out what the method is that's going to be best for you relative to developing policies, changing policies, and retiring. It's really important to also remember that we get to retire policies from time to time. So each policy needs to have an owner. That owner doesn't have to be Donna Thiel, a person. It can be a department. It probably is better being a department because when you have people leaving the organization, the last thing you want to have to do is touch every policy with their name on it. Think about an approval process. Do you have a compliance committee? Does it have to have a legal review, a compliance review, an HR review? Like, what are all those steps in order to have a policy approved? Same with that review process. Those are probably flipped in the order of them, right? Who's going to review each of the policies before it gets to that final approval? And then version control and tracking, we'll talk about this a little bit later, but super important that we all know what version of the policy we're looking at any point in time. And then when you think back about litigation or audits, really knowing the version is going to be super important. A central location, right? Do all of our employees really know how to find the policies? Are they on the intranet if you have that? Do you have a SharePoint site? What is your central location? If it's the director of nursing office and it's just sitting in a binder on a shelf, that might be a little bit of a challenge. So think about where you're going to house all your policies. And then certainly extremely important is communication and training, right? We just talked about, having a policy that's not followed is worse than not having a policy at all. So if our team members aren't familiar with the policy and they're not able to follow it, it's going to cause a lot of challenges in our organization. So we think these are kind of the basics of getting started with policy management. So let's move on to the next slide. So as you're thinking about these basics and where to start, here's a few maybe helpful hints, just some things to keep in mind. Certainly not everything has to be a policy, right? It could be best practice or it could be guidance. As Matt mentioned in the introduction, my previous life, I worked for a very large skilled nursing organization, post-acute. We had 200 nursing facilities in 13 states. So as you can imagine, the cultural differences in those different facilities was very significant. And if you had a policy that was very stringent, it might not really have met or fit in the culture of that organization. So thinking about best practice or guidance can be really helpful, even within the structure of process and policy. Again, making sure that your employees really know how to determine which policy is current. Do you have version numbering? Do you have dates? How are you making sure that the versions are clear, that they're the most current? We talked about litigation and audit look back periods. sadly, I can't tell you the number of times I had an auditor or someone from one of those federal agencies asking me about something that was 3 or 4 years old, and having to really search back and think about what policy was actually in effect at that point in time, so that we knew that we weren't holding ourselves to a standard of today that wasn't in effect 4 years ago. So again, that version control is a very important component. Another one is annual reviews, or certainly a periodic review of your current practice and your policy. So think about a policy that was written 3 years ago, and sitting down today to try to actually follow that policy. Could you have things changed, have resources changed, have links changed? Really think about a periodic review of those policies, and like we said, maybe you could even get rid of one or two, retire some of those. I think it's important that your policies look and feel the same. We have Sarah Hendricks on our team here at Provider Trust, who really beautifies our presentations and really holds us accountable to the Provider Trust look and feel. And I think that's very important in your policies, so that your team members know that when they're looking at something, it is the official policy of your organization. And then how do you organize them? Are you going to organize your policies by department, by owner? Are you going to have them in one particular place? Are you going to have them linked in all sorts of different places? And then just kind of an additional thought perhaps is, what about those historical policies? Certainly in compliance, legal, HR, we refer to those historical policies a lot, but does everybody need them? Or can you put those more in a secure location, limiting who has access? Matt, let's go on to the next slide.
Hey, Donna, can I jump in real fast? Because we had a really good question that was really relevant for the last slide. So we had a question come in from Mara, who's asking, is there a recommended template for the policy on policies that includes best practices for policy management, review, retirement? So I'm curious if you've either had one you use that you can recommend, or if you have a good place to look, or in your experience, is that something you've historically had to create from scratch? So I thought that was really relevant and timely.
Yeah, great question. So I definitely created it in my past life. And I would say, Tamara, if that's something that we could help you with after this session, I'd be happy to sit down with her and really think about what a template could look like. I don't have one right off the top of my head that I can say, here's a link and here's how to do it. But I think that's a great question and something we could certainly help with, for sure. Thanks for the question. And I apologize, I can't see my chat box and look at all of you all at the same time. So thanks, Dave, for doing that. So as you're getting started today and thinking about perhaps after this session, how is my policy management? Here's just a kind of maybe a policy procedure pulse, a few questions that you might ask yourself. Do you have clear accountability for who owns the process in your organization? Do you know when the last time you reviewed the actual policy on policies that we were just talking about? Do you review your policies every year? Is that overwhelming? So do you have a rotation schedule? Perhaps the clinical policies get reviewed in the first quarter and the financial policies in the second quarter. Think about what a rotation might look like. And have you ever actually randomly tested some of your policies to see if you can follow them, to see if they're actually doable? Maybe take a minute in your next audit. I know in this world right now where we're all in so many disparate locations, might be a little bit more difficult, but maybe pick 10 people that aren't at your corporate office and just ask them if they know where to find policies, and do they even know who to talk to if they want to change a policy or if they have a question. Again, looking again at that testing, right? Compliance, we love to audit and monitor. Have you looked at your policy library, wherever that library is for you, and made sure that only the current policies are actually available within your library? And then maybe, again, ask yourself, is there something that could be monitored, that could be reported up through your compliance committee, or whatever the methodology is or process in your organization would fit, so that you can really feel confident that your process is effective. So with that, I'm going to turn it over to Matt and a poll question, and then we're going to take a deep dive in maybe just one policy and how we would walk through policy management.
Thanks, Donna. Excuse me. This is our second poll. So again, appreciate you all joining in. and participating with us today. So our question is, how often is your process, the question should say, how often is your process reviewed and optimized at your organization? So is that, sorry for the typos on this one, you guys, but is that quarterly? Is it annually? Is it after an issue occurs? Is it that you don't have a formal review process, or are you not sure? So we'll let some answers come in here, and I will end the poll and share those results. So it looks like the vast majority are reviewing annually. That's what we see across the industry. So great job to you guys. And yeah, just again, appreciate you joining in for the poll today. So Dave, take it away.
Let me go off mute. Good afternoon, everyone. Good to see all of you through Zoom, I guess, because you can only see me. But we're going to go through a quick case study, and then to back up just for a second, right? So my name's Dave. I've given several of our webinars before. You may be asking yourself, why is the director of marketing on a webinar about policies and procedures? And I'm going to get to that in a second, but the answer is very intentionally so, is something that we would actually advocate for those listening on the phone, especially knowing that policies and procedures are owned primarily across compliance and HR, according to the poll and the attendees listening in, is how to actually cascade. How do you actually get adoption of policy and procedure on some of the why behind that? And we wanted to actually partner today to give a really good example and a case study of how we take a policy and actually cascade that across our own internal organization. And so myself in marketing actually partners quite frequently with Donna, who is our chief compliance officer, to say, what is our policy and procedure for a specific topic or a specific subject? And then how do we internally communicate that across the organization to really drive buy-in, adoption, and ultimately success in the process, so that it doesn't live and die in one department. I would say a year or so ago, we saw too often that even internally at Provider Trust, when we would set new policies or procedures out of our compliance division, too often they would just sit there in compliance. And so much of what I think that we would want to let you all know today is that it doesn't have to be the case. If you can build the right internal partnerships from a communication perspective, you can actually cascade involvement and adoption across your organization quicker and with a much deeper buy-in to the why. So we're going to do both of those in a case study. We're going to take you through some prompt questions about your policy and procedure for ongoing monitoring. For those that have been around Provider Trust, it's no secret why we picked this, right? It's what we do. So we interact frequently with health systems and organizations on what is your policy and procedure for this, and really help make sure it's ultimately keeping patients safe. And that's some of the why. And so when we look at our own policies and procedures, we attach the why in the internal communication to the policy and the procedure that we're actually crafting to create organizational buy-in and stickiness on why this is so critical and imperative to get right. So we'll start with the how, and then we'll get to the why. And so when we look at asking questions of your provider monitoring process, and I just saw a question come in too, and will slides be provided? Yes, you will get all the resources. You also get a recording of this as well for those that are asking. Question one is, who owns employee monitoring at your organization? So beyond that, take that one step further. We know it's probably not simple enough to say who owns employee monitoring and having it stop there. The reality is that multiple departments or functions probably own different pieces of employee monitoring, but ultimately who's accountable for the entirety of the process? And then who's accountable functionally for each part of the process along the way? Is it shared between HR, compliance, others? How does that, and how specific can we get? So much of an effective policy is specificity. And to what degree can you actually clearly articulate and define the functions and critical steps along the way for each policy and procedure to say, who does this? Who's responsible for this specific line item? Do you have, right? This is a look in the mirror question. Do you have a policy for what employee monitoring means, right? Yes or no? Does it exist? And that's a good look in the mirror question. How often do you screen your providers, employees, third parties for exclusions or disciplinary actions, right? So frequency, we often talk scope, frequency. What's the scope of your process and what's the frequency at which you execute? And is the frequency different across different populations as well? Very practical example. We're talking about provider monitoring. Is the frequency by which you screen your referring and ordering physician population different than the frequency by which you monitor your RNs that are on the floor at a critical time during a pandemic? How accurate is your provider credential information, and who is responsible for maintaining provider credential information, right? Specifically is who's responsible for updating name changes, location changes and moves, how that impacts licensure portability. How are credential concerns communicated across teams, and how quickly does this occur? Who investigates and mitigates these issues? And have you tested the process to feel confident it is being followed? Or has your process been tested? And what was the confidence? What was the confidence coming out of that? One of the poll responses was at time of an incident, right? What was the result, and how were the results of that incident communicated to appropriate stakeholders to say, how do we strengthen our policy in a moment of crisis? If we go on to the next slide, we'll actually I'll look at three pieces of this. And some of what we talk about at Provider Trust is provider monitoring. To do it effectively is actually predictive monitoring. Data doesn't just stay siloed across different verticals, even when you're talking about the same person. The reality is, if you have an effective monitoring solution, you need to monitor state licensing boards, the artifacts themselves, and the licensing boards are often predictive indicators of licensure status. And licensure status, about 50% of the time, is a predictive indicator of exclusion status. And it goes all the way through. So to what degree, and the reason why we say these three things is, too often in organizations, whomever is responsible for disciplinary actions on a provider is sometimes not the same department that's responsible for license verification, which could be even a third department that's not responsible for exclusions, right? Is there a predictive analytics approach to say, when there's a sanction, we can predict that there may in fact be an exclusion 12 to 18 months later, right? Can we get ahead of that now? What does that look like across teams? We see this play out. I was talking to an organization a week or so ago, and we saw this play out where we had, in this particular organization, HR was responsible for disciplinary action monitoring. IT was responsible for license verification as part of their systems, and compliance was responsible for exclusions, right? And that the three functions weren't necessarily working in tandem together. And so as you lay out your policy and procedure, are those three departments in that example working together? And on the next slide, here's the worksheet, right? So somebody asked if we were going to show the slides. Here's one to print off and actually go through and check, say, step 1, 2, 3, 4. Step 1 is establish clear policies and procedures and team ownership. Step 2 is reducing internal fragmentation and variability. Step 3 is enabling your team with the tools to support policies and procedures, as Donna mentioned in reference, the single source of truth. Step 4 is to create accountability and operational transparency. Step 5 is having an agile and flexible policy in the short term. And step 6 is a plan for achieving a comprehensive approach for increased success. This is a great sort of just print off at what stage of the game am I at in these 6 steps? And have I gone 6 for 6, or am I really 3 for 6? In terms of what exists, right? So it's not necessarily, I say step by step, but it's not necessarily in order. It is possible to do all 6 and also still have internal fragmentation and variability, right? So can you go back and solve for each of these 6 and use it as a lens through which to view your internal policies and procedures? So I'm going to go back into what Donna and I work together on is, how do we connect the why to a policy or procedure? And so often when we are working with organizations, many of whom are actually listening in today, when we work with organizations and we're talking through, okay, using that case study, here's a really effective, and we'll help you craft a really effective policy or procedure for ongoing monitoring. How do you get your organization broadly to buy into that? How do you get your own internal teams to buy into that? Because just because you have so often, right, the burden of creating a policy may fall on us as leaders, but I still need my team to be bought in to execute a lot of the daily activity or a lot of the work to make it come to life. How do I get my team to buy in? We've found at Provider Trust, just to give you an example of how we have done this and have consulted for other organizations to do it, is connect the why to your policy. And so in the case of ongoing provider monitoring, the why for us is connecting that back to the patient. And so in this case, I'm going to show you the exact slides that we have used to connect the why to the policy of ongoing provider monitoring. And again, you're going to get these, so feel free to use them in your own context and rebrand them and put your own logo on them, but the why is the same. If this is the policy you need to go create. And so if we continue on and go to the next slide, right, we reference this in other webinars too, but I'll quickly reference it again. When we talk about exclusions, Johns Hopkins released a study about a year and a half ago or so, in which they analyzed excluded providers and the beneficiaries treated under Medicare. And the reality is in a 3-year period, about 1,300 excluded providers treated over 1.2 million Medicare beneficiaries and received about $630 million in payments. And so continuing on, the Johns Hopkins reveals the why behind what's the profile of the patient treated by an excluded provider, and what does that actually look like on a financial or a transactional perspective. And in 1 year, an excluded provider on average treats about 333 patients. An excluded provider delivers about 24 services per year per patient, so about 2 a month in terms of services on average. How much money does an excluded provider receive from Medicare? Is about $168,000 a year. What's the average payment per patient to an excluded provider? And it's $500. And then taking that one step deeper, when we look at the profile of the patient that's more likely than not to be affected by an exclusion, we understand the patterns of race. Medicare patients treated by excluded providers are more likely to be Black, Hispanic, Asian, or any other minority group, and essentially non-white. And taking that one step further and looking at medical diagnosis and disability, Medicare patients treated by excluded providers are more likely to be diagnosed with depression, chronic kidney disease, diabetes, and heart disease, as related back to that Johns Hopkins research. And so for us, these are the exact slides that we use with our friends in the industry to say, here's the why for us when you're talking organizationally or you're talking to your teams. The reason why we care so deeply about getting this policy and procedure right for ongoing monitoring is because the why is to protect these patients with that policy. And we found that to be a really effective internal marketing, if you will, tactic in our organization, and putting the why behind the policies and procedures that were, from this point, we hope you go create a bunch of policies and procedures, but the reality is if there's a why behind them, you'll get organizational buy-in beyond even just you or your own team. You'll get other folks that are willing to lean in on this from a vision standpoint. So I'm going to kick it back to Donna to wrap us up, and then we'll get you rolling on the rest of your day.
And before we do that, we have one more final polling question. And the question for you guys is, how often do HR and compliance meet within your organization? So is that a monthly recurring basis? Is it quarterly? Is it annually? Do you have no routine meetings? Or are you not sure? Are you not within one of those departments, or are you not involved in those meetings? We're just curious of how the frequency of those. So we'll let that, oh great, you guys are voting really quickly. So we'll end that poll and share those results. So thanks again, guys. It looks like the majority of you have no routine meetings. That's not something that is unique to your organization. That is something we see, but we do like to encourage that collaboration between those departments. We've just been able to see a lot of great things come from that. So again, thanks for participating in the polls today. That's our last one. So with that, Donna, I'll hand it over to you.
Thanks, Matt. And maybe just one thing as we move on to the next slide. I think what Dave was just talking about, and really the why behind the policies and tying it back, it's just so important in the world that we're in today with all the challenges that we have. We are just fighting an uphill battle in so many ways. And I think regardless of if it's the why behind the policy, maybe it's just the why for us coming to work every single day is our patients, right? Every one of us that has worked in the healthcare space, I can certainly say from my experience that it was really hard for me to leave the post-acute world. I will always have a place in my heart, and Matt and Dave both know that I spend an awful lot of time in that space still today, and I spend a lot of time with our post-acute clients and my colleagues that I'm comfortable with. So I think as you kind of leave today, we hope that you'll have some insights on policy, but maybe it is just a quick break from the chaos and the craziness, and an opportunity to just refresh a little bit and remind ourselves that we're here truly every day to take care of our patients and the people that serve our patients. So let's talk just a little bit about the changing roles and the new demands. It is harder than ever, right? If you think about your role and ask yourself, have you seen significant changes within your organization, within your role? If any of you say no, gosh, I think you might be fooling yourself, because I think even at Provider Trust, and we are not taking care of patients every single day, but hopefully supporting you in ways that we can. We've seen a significant change. New responsibilities, obviously due to COVID, the never-ending regulatory changes, my goodness, excuse me, the things that we're responsible for monitoring right now from a regulatory environment just doesn't stop, with the different emergency declarations and things we can do and we can't do. That's a lot for everyone to monitor and to manage. We talk about telehealth and telemedicine, right? All of a sudden we have new providers in our space that we didn't perhaps have yesterday, or if we did have them, maybe not to the capacity and to the extent that we have today. So how are we monitoring and managing that? What policies have we written surrounding all of that new functionality? We may have volunteer assignments. We might have retired professionals that now can have come back into the workforce, and how are we supporting that? So if you think about how are you preparing and meeting these demands, I'm not sure that we know what normal is anymore. I'm not sure if we will, quote, return to normal. I doubt it. I think it's a new normal, and preparing for that new normal. Looking at your policies and procedures and oversight and education is really more important now than ever. Are our old policies even applicable to the world that we're operating in today? I personally, Matt talked about in our last poll, the frequency of HR and compliance. And if you don't want to be HR and compliance, be HR compliance and operations, HR compliance and legal, clinical, all of the different departments. Partnerships are more important than ever. In compliance, it's my most comfortable place to talk about, but we are often kind of the bad news police at times, and really making sure that you have partnerships within the organization so that others can help share your value and shine the light on the things that you bring to the organization. I think it's more important now than ever, and really being a partner in this environment where many of us are working from home becomes more difficult and really needs to be very purposeful. And lastly, in this particular conversation, understanding your staffing requirements, upholding those compliance standards. I would even add really understanding the staff needs as opposed to staffing requirements, I think are really important in being able to provide the best possible care for our patients. Matt, let's go to the next slide and talk a little bit about what we're kind of summarizing as the 3 C's for success. Collaboration, coordination, communication. Again, in this environment, I think these 3 are more important than ever. Let's start talking just quickly about collaboration on the next slide, Matt. Collaboration doesn't, again, have to be just between HR and compliance, right? Just making sure that we are clear on communication, that we're communicating the new guidelines, but we're doing that in an atmosphere of collaboration between all of the different teams that are impacted, making sure that our teams have resources and tools and support from us that they need. Dave mentioned before the ability to be agile and flexible. We don't know what's going to change tomorrow. We don't know what our workforce looks like tomorrow. Does our workforce all of a sudden in Wisconsin, where I live, our numbers are just skyrocketing for positive COVID outcomes. That probably means a significant impact on our staff and our ability for our staff to come to work every day. So what you being agile and really having collaboration in place is going to allow you to be more successful and begin planning for a comprehensive approach to manage post-COVID. I think that it goes without saying, but I don't think we even know yet what that looks like. So let's talk about coordination. We've been talking about policies and procedures today, and certainly as we think about all of the changes that we've been having since March and in the future, really understanding who's tracking those changes. Are we making permanent changes? Are we making interim changes to policies? Do we even know if there's policy violations? Are we tracking that? It's really important to be thinking about coordinating who's going to be tracking that sort of information. From compliance, we just talked about the regulations are changing. Are we able to stay on top of making policy changes? Are we documenting those as interim changes or permanent changes? Again, making a decision about how we're going to manage these policies in the near and long term. We talk about HR and compliance, and in my humble opinion, it's a really important relationship, and I would strongly encourage everyone on this call to think about what that cadence looks and feels like, so that we can build that relationship and build the coordination. People are working outside of their normal role. That's important for HR to be communicating to compliance, and vice versa. Make sure that we're communicating. If someone's in a new role, are there new licensure requirements? Are there new oversight requirements? Are there different policies that they need to be familiar with? And are we treating them in a orientation sort of role, or are we just kind of pushing them into new role because we really don't have time? So how do we go back and make sure that we're giving them the education, and we can ensure compliance for all of our team members that are working kind of outside of their comfort zone? And last of the 3 C's, Matt, if you want to move on, is communication, right? We just talked about that. It's really essential that we're communicating to our team members on a daily basis. What's coming, what's changed, what they need to do. Do we have to have 5-minute stand-up meetings? Do we have daily email communication? I'm sure we all have COVID teams that are providing routine updates, making sure that we're really connecting with the people as to what matters to them. What matters to me? How do I make sure that people are understanding and talking in a way that is most helpful to each individual? Really positive and encouraging messages. It's a difficult day. It's difficult for all of us, but just really being that positive reinforcement from the organization of speaking a positive message. And really just tell them what they need. Like, how do we help them the most? There's a few resources over here that we've certainly used over the last few months. As we wrap it up, let's just kind of summarize in how to get started. Matt, if you want to get ready. So getting ready for 2021, it's really getting ready for right now, right? Let's define clear accountability. Who owns this process? Make sure that we know what a review looks like. Making sure you're tracking these policy changes so that we make sure that we know, actually said policy changes, I meant policy violations. Sorry about that. If we're not meeting our policy, if we have policy violations, is it because we have a bad policy? Is it because we haven't communicated those policies right? Do we even know? Are we tracking that? And I think that's something between HR and compliance is a really good area for collaboration. Testing to make sure that your team can follow the policy. It's really important. Sit down and actually have someone walk through the steps. Can they follow them, or have we created an impossible policy or procedure? Again, check to see if people know how to even ask for a change in our policy. And then really think about metrics to report or monitoring activities for next year. When you look at how do we look better and feel better in 2021, metrics to monitor are always a great place to start. And of course, educating and communicating. If we make changes, if people don't know that and we haven't communicated it, we're never going to be able to follow our own policies. So on behalf of Provider Trust and Dave and Matt, even though Matt turned his camera off, we appreciate that Matt was on camera today with us for a little while. There he is. We all know that what gets taken apart has to be put back together. We are confident in all of you that you can do that. Compliance, HR, legal, operations, clinical, we're all partnering to understand these regulations, the safety concerns to our patients and our staff, the transitioning operations, and really the overall mental health of our staff are keys to overcoming the never ever ending challenges and the unknowns of 2021. We know that you have this. We at Provider Trust are here to help you and support you in any way possible. You've got this. We know you do, and we really appreciate you joining us today. And I will turn it back over to Matt and Dave to say their final goodbyes. Thanks, everyone.
Yeah, thank you, Dave and Donna, for being with us today. And thanks everyone on the call for choosing to spend your time with us. Thanks for sticking it out. I know we're a little bit over time, but we do appreciate it. We are here to help, and we want to help in any way that we can. So please lean on us when you need us. We have a very extensive resource library that's updated on a weekly basis with new resources, blogs, ebooks, case studies, and of course these ongoing webinars. So don't hesitate to chime in there and see what may be valuable for you. So I just want to say thanks again. We do have a survey after today's session here in just a second that you'll be prompted to fill out. I just ask that we so appreciate that. It helps us to make sure that we can continue to bring value to you guys and talk about the things that you want to know more about. So with that, I will say thanks again for being with us today. And thank you, Donna and Dave. I hope you all have a great rest of the week.